Good. Have you ever wondered what is pranayama? Pranayama is a yogic word, means prana is force of life and is a practice. And it is traditionally described as the regulation of breath to influence body and mind. Interestingly enough, breath work is a direct and a mechanical tool for hacking your autonomic nervous system. By consciously altering your breathing practice, you can naturally or manually shift your biology from a stressed, which is a fight or flight mode, to a rest and digest or the parasympathetic state. Modern research has started to explain many of its beneficial effects through physiology, neuroscience, and psychology. So there are certain facts that I'd like to talk about in pranayama. One is breathing and heart rate connection. Heart rate increases with inspiration. So each time you take a deep breath in, your heart rate increases and decreases with breath out, which is expiration. Nasal versus oral breathing. Traditional pranayama strongly emphasizes nasal breathing, and modern science supports this. And the reason for that is because nasal breathing filters and humidifies air, producing nitric oxide in sinuses, which may help circulation and oxygen uptake, encourages slow breathing patterns, and improves diaphragmatic breathing mechanics. Let's get into the neuroscience of breathing and the vagus nerve. Vagus nerve is one of the largest nerves in the body, and it's the main communication pathway between the brain and the internal organs. So when you do slow breathing, it affects vagal signaling through several mechanisms. Stretching those lungs will signal your brainstem to slow everything down. Exhalation, deep exhalations tends to, again, stimulate that vagus nerve or the parasympathetic activity. And slow respiration synchronizes your heart rhythm and your blood pressure oscillations very efficiently. And this is why calming breaths emphasize long exhalations, slow rhythms, and relaxed diaphragmatic breathing. The physiology of pranayama is a little bit interesting because breathing is unusual because it is both autonomic and consciously controllable. That makes it a direct way to influence the autonomic nervous system. Slow, controlled breathing tends to increase parasympathetic activity, reduce excessive sympathetic activity, and improves heart rate variability. And if the higher the heart rate variability, the more you are able to deal with stress and anxiety. And breathing, slow breathing, or decreased number of breathing per minute, like 5 to 6 breaths per minute, appear especially effective for vagal activation and cardiovascular synchronization. What are some of the beneficial effects of pranayama? Neurologically, EEG and imaging studies suggest some pranayama practice may actually alter attention and emotional regulation networks, improve sustained attention, and reduce perceived stress and anxiety. And all of them are associated with relaxed alertness. The cardiovascularly, certain breathing techniques can lower heart rate, modestly reduce blood pressure, improve your blood pressure regulation. And these effects are strongest when you're breathing slow, regular, and in a relaxed way rather than a forceful way of practicing. So let's look at the evidence, the quality evidence that's behind pranayama at this time. Science is promising but mixed, and many studies are small, heterogeneous, and methodologically limited. But there is very strong evidence for stress reduction, anxiety reduction, improved autonomic regulation, better subjective well-being. And there are certain small claims about improving detoxifications, increasing in oxygen levels, and supernormal cognitive abilities. Now, like everything else, there are risks and contraindications. Some pranayama practices can create problems if done aggressively. Hyperventilation syndrome, panic sensations, fainting, blood pressure spikes, and headaches. They can be aggravated by if done aggressively. People with cardiovascular disease, epilepsy, or seizure disorder, severe anxiety and panic disorder, respiratory illness, pregnancy should be very cautious with intense breath retention or forceful breathing practices. Some of the examples of pranayama techniques are, and the mechanisms are as follows. Slow diaphragmatic breathing, or the dirga breath, the three-part breath. Samavritti, which is the equal breathing, and they likely cause parasympathetic activation, reduce cortisol or stress response, and improve emotional regulation. Alternating nostril breathing, nadi shodhana. Research suggests that they can reduce anxiety markers, improve attention, and possibly balance the parasympathetic and the sympathetic nervous system. Fast breathing practices. Examples are Kapalbhati and Pastrika breath. They can increase arousal temporarily. They do stimulate sympathetic activity initially, and then they can also increase alertness. But in some situations, if overdone, they can also provoke anxiety and dizziness. Breath retention techniques is another way of practicing pranayama. They cause intermittent hypoxia, and they can be useful in increasing focus and arousal, stress adaptation responses. However, if they are done for a longer period of time, specifically people with cardiovascular and neurological illnesses, it can be a problem. So what does a scientifically grounded beginner practice approach looks like? Nasal breathing. So if you're confused about all of this, just practice nasal breathing. If you're anxious or you don't have enough focus, just breathe through your nose for 1 to 3 minutes and see what happens. Diaphragmatic breathing, like we talked about, moving that diaphragm will stimulate that vagus nerve. Slow rhythmic breathing, again, moving your diaphragm or not, just doing deep, slow rhythm breathing, 5 to 6 breaths per minute. Gentle exhalation. So if you're anxious, if you have just before sleeping, if your mind is racing, gentle exhalations can really drop your anxiety levels and improve those calming hormones. These practices, if done 5 to 15 minutes daily, can be beneficial over the period of time. And these practices align closely with many traditional calming pranayama systems and with modern autonomic regulation research. If you want to learn more about what might be the best suitable practice for your health, please contact us at Holistic Health MD.